Pelham Medical Center. We are in Greer, and I'm with Terry Donahue. She is the community outreach manager, and she has a team of people here at the hospital that are going to cover a variety of careers they have here at the hospital. So Terry, take it away.
Thank you, and welcome for attending. As my role, community outreach manager, is my responsibility to kind of connect the community with the hospital and the services and programs that we offer here. Today we're set up in the simulation lab, or STEM lab as we call it, and the purpose of this room is a converted patient room, and it's to educate, continuing education for our clinical staff, as well as just displaying some of the things that we do here at the hospital. And so today we have a lot of careers that are going to come in and talk about what they do, their role, how they interface with the patients, and talk a little bit about how they started their role and what they do here at the hospital. And we'll start with our rehab services with speech and physical therapy. They're here today, and we're going to start with them first.
In addition to the rehab service, acute care service, which is a hospital setting, we can support the children system. We can do outpatient settings in the clinic. We specialize with neurological patients, strokes, MS, Parkinson's disease, orthopedics, total hip, total knee, total foot, general athletic injuries. We can also work at home. With home health services for the patients that are discharged home. We want to make sure that they're functioning within the highest level.
What's the difference between what you do and a physical therapy assistant?
The physical therapy assistant program is a 2-year degree. For the most part, it may take 3 years because there are some key requirements that are at each school. But generally speaking, they would need anatomy, physiology, kinesiology, English, math, and then you go into a PTA career. There are 7 within the state, 7 programs for physical therapists. Then they work on having the physical therapists to provide. The difference between a PT and a PTA is actually the schooling and the fact that the physical therapist is the one that evaluates to then implement the plan of care, implement goals, and the physical therapy assistants are the ones programming.
The exercises.
The exercises, mobility. We are known as the mobility experts.
Great.
So they will assist the patient. Barriers, motion, strengthening, transfers, the ability for the patient to walk that with the different devices, a walker, a cane, whatever they need.
Right. And what's the average pay, do you know, for a physical therapy assistant?
At a entry level, about $25 an hour.
Okay.
At a maximum level, we think about $37. However, if they become a PRN, it could be up to $45.
Oh, wow. Wow, that's great.
2-year degree is not bad.
No, not bad. And so you do speech.
Yes.
How did you get into speech?
I had no idea that speech therapy existed until I met a friend who was a speech therapist, and I was actually a psychology major at the time and wasn't really feeling the psychology thing. So when I discovered speech therapy through my friend and she explained it to me, I was very interested in the field, so I ended up shadowing her and just fell in love with it. And then I got into a master's program after I got my master's in psychology, and to finish my master's and got into the career.
What do you like most about what you do?
Well, in the acute care setting, our primary role is to work with patients that have swallowing issues or dysphagia, and that is my passion. I love working with those patients. There are a lot of patients that are not able to swallow well, and then they can't eat and drink, so it's my role to go in there and determine what is safe for them to eat and drink, how can they modify what they're doing to eat and drink safely, and then get them to the point where they're going to safely do so without getting food and liquid in their lungs, because we don't want that. And when I get a patient that might not have been able to eat and drink at all to the point where they're going to actually be able to consume something by mouth, it's so thrilling for them, and it's very motivating for me as well, a very rewarding part when patients go from not eating to being able to eat.
Yeah, that's kind of an important skill to have, to be able to swallow and eat. Are there any speech therapy assistant positions?
There are, not usually in the acute setting in this state.
Okay.
Speech therapy assistants are more in the schools or
Okay.
early intervention, and that's similar to the PTA. It's usually a 2 to 3 year program, and they do the same thing as far as the speech therapist goes in and evaluates and creates a care plan, and then the assistants go in and actually do the treatment.
I am behind all the results.
Uh-huh.
So I go into the patient's room or as an outpatient. They come in here and the doctor and nurses put in labs. So we can check your CBC, CMP, all that stuff that you need to be checked on. And we draw it and we send it out to the lab and we spin it down and we put it on the machine so we can get the results for the doctor. You know, all the levels and for the medication. We do all that fun stuff.
So how did you get interested in phlebotomy?
I had no idea this was a program. And so I got into Greenville Tech and I was actually going in there just to get my prereqs. And there was something like this going on because we're just talking about it. And I had no idea. And then it was a 3-month program. And I was like, well, let me just do it to get my foot in the door. And I fell in love with it.
Right.
And I've been doing this for 4 years now.
What are you doing here?
So this is all the stuff that we use. These are all the tubes that we use. Each color represents each department. So these 2 tubes go to chemistry. This goes to coag, hematology, chemistry, and this is blood bank. So each tube represents something different. So each tests something different too. So that we can check your blood type in this. So we can give you, I need your blood transfusion or anything like that. We test your blood. We can't just give you certain blood. You're like type A, type B, all that good stuff. We just can't give you like just random blood. And lactate, we can check your septic, and then just check your clotting factors. There's just a whole bunch of stuff you can check on these tubes, and it's just honestly just really cool because each level will just represent something different.
Right. Do you also draw the blood? I
do, yes. And then we call this a straight needle. We call this the butterfly. A lot of people prefer butterfly because it's just small needle, and this is for little babies. So we stick on the heels of babies, and we use these smaller tubes for them to fill them up.
And what's that like, taking someone's blood?
Honestly, satisfied when I get the blood flowing. It's a really good feeling. And a lot of people don't like us. A lot of people call us the vampires because like we just come and stick them with needles. But I always tell them this is to help you out. So
right.
To give your doctor to give you your medications that you need.
Was it hard to learn how to do it?
Honestly, no. It's really easy. The only hard part is like you have to memorize all the departments and the tests that go to each department. But other than that, it's not that bad. You just have to know exactly where the vein is at. You need to go by. A lot of people go by eyesight, but it's not necessarily. You just
right.
go by feel. And you feel the vein, and then that's where you go.
Have you had people refuse to let you take their blood?
Yes, a lot of people don't like it, which I understand. You tell them you're sick and you've been stuck multiple times, but we just tell them it's for your good. It's for your own good.
Are you able to like calm them down?
Yeah. Oh yeah. Like if you know the patient's like really uncomfortable and stuff, or bring somebody else with me, get them to talk to them, and then I'll be over your other side, just drawing the blood.
Right. So, are there a lot of opportunities for phlebotomists?
Oh yes, we're always looking for them. So if you always want to go, I know Greenville Tech, Farmer Community College, a lot of community college have this program, which is amazing because it's like I said, it's only 3 months. And then if you don't like phlebotomy, you can always like move up to become a lab tech.
Okay.
So that's what the people who actually go into the machines, and they're the ones going to give you the results.
That would be with a phlebotomy certificate?
That'll be a lab tech. So that's a 2-year program.
Okay.
So you can advance in phlebotomy if you
right.
like it. But being in here, you can just get your foot in the door. And I always say it's like really good to know about this, especially if you go become a nurse. You know all this stuff and be able to help out with your patient more.
Right. Can you speak to the pay range for phlebotomy?
Yeah. So since, like I said, it's just a certification that we get, so it's a 3-month program. We don't get paid a lot, but we start off at least $16 an hour.
Okay. Starting out.
Yeah.
Not bad.
Hi, I'm Joni, and I'm a registered nurse. I'm currently a bachelor's level nurse, and in a month, I'm a master's level nurse.
Oh, great.
Nursing education.
Uh-huh. And how did you get started as a RN?
Well, honestly, I thought I was going to be a veterinarian.
Okay.
But then I kind of found a medical assisting program, which is kind of an entry level position. I worked in a clinic for a really long time, and I kind of found that nursing was the route for me.
Okay.
And I worked my way up to LPN, and then I got my registered nursing, and here I am.
Yeah. So how did you get the RN? Was that through a technical college program?
So I did 2 technical programs for medical assisting and then for my LPN. And then I moved on to, and during that time I was doing a 2-year community college, and I got all my prerequisites for my associates. And then I did kind of a non-traditional route. I got an LPN with DSED program, which was mostly online.
Great.
So that was a little different. And then since then, I've done mostly online classes all throughout my education, like all of you.
Oh, great. And were there opportunities to have tuition reimbursement or scholarships?
Yes. I, fortunately for my master's program, I was able to get a full scholarship.
Wow.
So those opportunities are out there. The hospital system, Spartanburg Regional, they offer great incentives and reimbursement programs to help out new graduate nurses. So.
Great. Are there a lot of LPN opportunities?
So as time goes on, we're finding more and more that we need LPNs in the hospital system for team-based nursing, and so that's slowly kind of coming back. So they're not just going to be out in the nursing homes and out in the clinics. They're going to also be in the hospital system again soon.
So what's the difference between what an LPN does and an RN?
So an RN, kind of like the physical therapist I talked about earlier, we kind of do the evaluation and help out with the implementation of the plan according to whatever the doctors have ordered. Whereas, and we can do assessments, whereas like an LPN is kind of working in a different scope. And so their responsibilities, they can do much of the same things you can skills-wise within like hospital parameters, but they're not going to be able to do that assessment and be part of that patient planning process.
So like deciding what medicine they need or what procedures?
So that we can make a suggestion to the doctor, and then they put in a formal order if they think that that's the best step.
Okay. So the LPN would be administering those orders, but not making the orders.
Yes. And there are certain types of medications that they don't administer, only the RNs do.
Okay.
But that's, for the most part, it's very helpful to have someone who can do the majority of the things that.
All right. Okay. Well, great. And can you speak to the pay range between LPN and RN? And
for an RN starting in the hospital as a new grad, it would be maybe around $28 to $30 an hour, and that's just your base pay. If you work nights, if you work weekends, if you work, like I'm a Baylor nurse, I only work at night on the weekends,
okay.
So they have a significant differential.
Right.
For that, if you're a resource nurse where you're traveling all over the hospital system, that's significantly different.
Okay.
I would say, it's possible that, they're in the high 18 to 20s for an LPN.
Okay. Yeah. And that's a 1-year program.
Yes.
LPN.
And a vocational program, it can be even like 11 months. But to go to like a community college, I would say it would end up being about a year.
Hello, my name is Drake. I'm an emergency service technician, meaning I work in the emergency department. So I guess the bread and butter of our role is kind of nursing support. So I can do EKGs, I can do straight sticks, I can do vital signs, I can do multiple patients, I do patient transport. I do a lot of the dirty work, I guess you could say.
And how did you get into your current role?
Yeah, so I just finished college last May, and I plan on going to medical school this summer. So I wanted to have some more patient experience with applying to medical school. So that's kind of how I got into this hands-on patient experience. That it really provided one-to-one contact with the patient, which is very important for someone wanting to go to medical school.
Right. Does your role require a 4-year degree?
No, my role does not require a 4-year degree. It requires a high school diploma, and it requires basic life support training, which is only a day or two certification.
Okay. What do you like about what you do?
I really like the ability to talk to patients. Another role is a scribe, and it is very popular for people wanting to go to medical school to become scribes. But I think becoming a technician really allowed me to get to meet people, get to talk to people, and do hands-on stuff with the patients.
What is the most difficult part of what you do?
Oh man, the hardest part of what I do would probably be the dirty work.
Okay.
So, if a patient is unable to clean themselves or kind of dealing with excrements, pee, food, that type of stuff.
Right.
That's not my favorite.
Right. Well, what suggestions would you have for a student that is interested in emergency services, but they're not sure if they would be interested in your role or another role?
Yeah, I think it's a really good thing to do to kind of dip your toe into the medical field, because it does give you a wide array of patient experiences,
right.
and it does especially different tasks that people do. I definitely think you should maybe shadow in the emergency department, maybe shadow a nurse, shadow a physician, and see if that environment is for you, because in the emergency department it's very fast paced, patients are coming and going, so once you find out that the emergency department is for you, I definitely think it's a great role.
Does Pelham allow for high school job shadows?
Yes.
Yeah, for different departments? All departments.
My name is Leanne. I'm the manager of imaging services here at Pelham. So X-ray, CT, MRI, nuclear medicine, all of those different modalities where we look at the inside of the body. So your providers, your physicians come in, patient has abdominal pain. Well, they can't see through the patient, so they don't know why. So that's where the lab comes in and imaging comes in to help diagnose patients and figure out what the root cause of the issues are.
And how did you get into your role?
I actually started in phlebotomy.
Okay.
So as our last speaker was saying, dipping your toe in is a good way to get into the industry. Just find something that you think you'd be interested in, get into the hospital setting, the healthcare setting, and then explore your options after that.
Yeah.
So I started with phlebotomy. My intent was to be a medical lab technician, and soon discovered that was not what I wanted to do.
Okay.
And then I was introduced to radiology, and it went from there.
So what did you like about radiology?
I'm kind of a nerd, so I like the why. I like figuring out why something is the way that it is. My field is actually nuclear medicine, and I have some slides here that I'll show the different modalities. So you basically start in X-ray. I don't know if you see that. Is it Blair?
Yeah, I can see.
I just included a picture of the different machines and then what an image would look like. So this is just an X-ray. This is basically where you would start if you wanted to come into the imaging field. Yeah. Most people start with X-ray, and that is a 2-year program.
Okay.
Then there's CT or computed tomography. You can tell these images are much more detailed than just a regular X-ray. And then that's a CT scanner.
Okay, so a CAT scan.
CAT scan, yeah.
Okay.
And then we have nuclear medicine. This is what I do. Again, the patient becomes the radioactive source at this point. We inject radioactivity into the patients and then watch organs function. So your bones are an organ. So you can see in this image that's just images of a patient's entire skeletal system.
So they have a fluid injected
in a vein.
That will show up on the image.
That's correct.
Okay.
And then, of course, MRI is a magnet. And you can see MRI is very detailed. That's just another subspecialty in imaging.
How would you become an MRI technician?
It's just an extra schooling. Now, MRI, nuclear medicine, and ultrasound, which is here, you can attend those programs without going to X-ray first.
Oh, really?
So if you wanted to just delve right into one of these subspecialties, you could. But then,
how long would those programs be?
They vary from a year to 2 years. But basically, you could do anything in imaging in 2 to 2.5 years.
Great. So,
and that's an ultrasound, and that's an ultrasound machine. They're portable. You can go do that bedside with a patient. Most people think of ultrasound as looking at babies, but you can look at anything. I think in this image is some kidneys and a spleen and a little bit of everything. But you can see from image to image that they're all very different.
Yes.
Much more detailed and different, and it's just all in what you're interested in.
Which one do you like the most?
Nuclear medicine. Nuclear. They have to be compassionate. You're dealing with patients that are scared sometimes. They don't know what's wrong with them. They want to know why they're feeling the way that they are. So you have to be compassionate, and you have to like science.
So knowing all the bones and all the muscles and things. Do you also have to know like physics or other types of sciences?
Well, there are physics. There's X-ray physics. In mine, there's nuclear physics. So it just depends on the modality that you go in. MRI would have magnetic physics, things like that.
What's the most difficult part of your job?
My job as a manager, managing people. Management is a different breed all in itself. I enjoy taking care of patients as well. So anytime that I can get back out there on the floor, I enjoy that.
So starting as an X-ray technician, what would the pay be like for that?
X-ray techs straight out of school start at about 23 to 25 an hour. And then each modality above that pays a little bit more.
I'm also a registered nurse like Jody. My background is in neurosurgery. I've been a nurse for 14 years, and I'm a traditional student out of high school, got a bachelor's degree. But one thing I think is super valuable in healthcare that I want everyone to know is you're working with people all the time. So even if you are behind the scenes working with peers and you're coming in contact with visitors and patients and coworkers every day, and something, if you're interested in healthcare, that I think really helped me is maybe getting a job like in tech, just getting that experience or volunteering. I worked retail and I was very shy. I was very quiet. Working with people, kind of brings you out of your shell. So I think my retail experience, or maybe work in customer service or food and beverage or anything like that, where you can just get exposure and get used to that. Because one thing I didn't know about healthcare until I started in it was how much it's a customer service world that we work in. If you come into the hospital with an infection, yes, we want to get you better, but it's all about the patient experience. And that really comes down to a lot of and how we are seen in the community. So just keep that in mind if you're thinking about where I work as a hospital educator here at Pelham, master's degree in nursing education. And part of my role is being over our simulation lab here that we're in today. So we've got Sammy, our mannequin, over here, and he has a lot of different functions and things that we do with our nurse residents, and we can put catheters in tubes in his nose, we can listen to his heart lung sounds.
Well, how long would someone spend in the simulation lab?
Sure. Our simulation labs offer a variety of experiences here. So we have nursing orientation. So we have nurses and PSTs, PCAs, companions come in, and we have a lot of introductory things we have to go over. But then we get a chance to come in here and do some fun things. We get our hands on the code card that you can see over here. And this is what you always see in the movies and TV shows where they're like, get the crash cart.
Okay.
And they, wheel it into the room. And then we do that sometimes for like an hour. We talk about CPR importance. And then we have new nurse residents that we use this with, where we have different scenarios that they may or may not be put into one day. And we give them a little background about it, but ultimately we have our patients here that they have to take care of. Things may happen, things may evolve. They're expecting they may need to call the doctor, which is usually me behind this room over here. This is a two-way glass.
Oh, wow.
Thing from behind there. I'm the voice of the mannequin, the voice of the healthcare provider. So they never know what they're going to walk into, but we can be in here all day sometimes.
Wow.
Doing different scenarios and simulations. What kind of practices.
And they'll be by themselves in the room.
They can be by themselves, or they may come with a team. So there may be a charge nurse role, there may be the assessment nurse role, and then we may have a rapid response happen. We have other associates in the hall pretending to be that team, and they come in and they work together. So they can go into different roles in the simulation lab. So we have a lot of fun in here. We've got him dressed up today with a little wig and some glasses. He can be a little bit of everything. We also have like our IV arm in here. We practice for sticks, drawing labs. So we get a lot of love out of this space. But this is a safe place to practice.
Yes.
And whether it be sometimes we'll have a person in here, an associate playing the role of a family member who's upset. How do you handle that? And that's hard to kind of mirror sometimes with a mannequin. So we may have actors in here as well. patient. So it's a safe place to practice and then learn. We debrief after we have those simulations and experiences. What will well, we want to do different next time, and that's so important.
We do have a student shadowing program, a formal one. It's called High School to Healthcare.
Oh.
And so you can go to spartanburgregional.com and just do a search on high school and find out about that program. The application is open right now until I think April 9th.
Okay.
And so that's a pretty competitive program. It's a 2-week program during the summer, and you are onboarded, so you're able to go have access to a lot of careers within the hospital. And also, if you're not in the Spartanburg-Greenville area, just go to your local hospital and kind of do a search on that, because a lot of the hospital programs now have student shadowing programs where they allow students to come in. Some of them have the age restriction of 18 plus. I know to volunteer in a hospital, you have to be 18 years older. So just check out the hospital website for information about those opportunities.
Right. But to job shadow, it's just high school age.
We do. We have high school and college.
Okay.
Programs,
but not the 18-year-old requirement.
The high school, no, it's not an 18-year-old or older. But some of the different departments have a requirement to do that, like our OR to observe some of the OR procedures and stuff like that. You have to be 18 or older. But to participate in the program, you have to be a rising junior. Here at our facility.
And is it a full day schedule or?
Pretty much, 2 weeks.
Full day for 2 weeks. Great.
You have to be a high school graduate. To be employed. And then there's some very short certification process like EMT, CNA, those programs where we actually pay for the student after they graduate high school. And it's you pay for that, and you just give us a year commitment, and then you're.
Wow, that's great. So you could get paid by the hospital to get your CNA or your EMT.
Yeah, they provide the materials that you need to do that, and then you give a year commitment at least, and then you're employed. Anything you want to do in a hospital, our hospital president says you want to be a pilot, you want to be a lawyer. There's opportunities in the healthcare career, in the healthcare field that you can do that. Food services, we have chefs. The sky's the limit.
Makes sense. It's like a little community.
Yes, we have several charter schools in the area, and they are doing enrollment. And then actually, Greenville County schools, I think all of their schools have good enrollment.
So some of those high school students are getting certifications in the health field while in high school. While you're in high school.
Yeah.
Awesome.
It's called Scholars Academy.
Called Scholars.
Scholars Academy.
Scholars Academy.
But it's not for the employment. A camera's turned on with the psychologist can see the patient, hear the patient. And then there's a good screen where the patient can also see the psychologist. And then we all step out of the room. And then the psychologist reports to the ER doctor.
The design was actually an award-winning design for the hospital.
Award-winning? So what award was that?
There's an architect service that deals with healthcare facilities.
Neat.
And so it won the attention of that organization. And I think it's highlighted on our website.
Oh, great.
Center, yeah.
Do a lot of patients comments on Yeah? What kind of
talk about how nice it is, how homey, how warm it is, and then of course that's your first impression is what you see externally. Then you're treated well by the staff as well. So.
Do you find that patients that come were referred by other patients sometimes?
They are, yes, and then word of mouth is really big. They talk about how they were treated, and they encourage people to come.
Great.
So we have a very good focus on our ER services. So, low wait times there, so that work gets out, and a lot of people come and take advantage of that as well. And then with us being a small 48-bed hospital, you still have that community feel. So that makes a difference. So we do have a chaplain staff who meets the spiritual needs of any families that are here or patients. During COVID, we live streamed some services out of this chapel. So just as a way of trying to help, with our providers and our patients who just didn't have access to people.
Is this space used often?
Hit or miss, yeah. It just depends. Some of the families will come in and have prayer, or they'll submit prayer requests. Some just like to come in and have a quiet space, just to think. So it gets used fairly frequently, yeah.
It's definitely pretty. I love the pictures. Yeah. And you said these are all local.
Yeah, even the stained glass was done by a local stained glass cutter in Greer. And so he's no longer in business, but we were able to get him to do the windows.
And what space is this? Just a lobby?
This is just the lobby for the 4th floor.
Wow.
So this is our employee business area, so this is open to employees who want to come in and work out, either before or after work or on their break.
Cool.
Of course, we have a few showers around here.
Oh,
so
good.
they're able to do that. Then you've got a nice view as you're working out.
Yes. You can see the foothills in the back.
Yeah. Our staff who wants to enjoy just sitting a minute and taking a break.
Is it like those that you see in the mall?
Yeah.
Yeah?
Yeah.
But you don't have to put a quarter in?
No, we just sit in it and turn it on. So,
Great.
there's plans to kind of add to that space and kind of make it a little bit more, peaceful in there. Right now we just have a massage chair.
Do a lot of hospitals have massage chairs?
I think since COVID, there was emphasis on self-care for the healthcare workers, and so I think there's more now. We have 5 campuses with Spartanburg Regional Healthcare System, and so all 5 of our campuses actually have a massage chair. You can go from the 2nd floor inside of Gibbs over to the hospital and have access to the hospital. The reason is, if we ever needed to admit cancer patients to the hospital, we've got a route, because you can't just wheel a bed or wheelchair all over campus, but this gives direct access to the hospital. You have to have so many specifications for radiology, so that's kind of why they built their independent building.
Okay, their own building for radiology. Okay.
Audio visual, 2 screens. You can pull up a partition and actually have 2 separate conference rooms, and they are independent of each other. Or you can pull the partition, have it open, and use the entire space.
Does it get booked a lot?
It does. It's very popular. It's available to the community at no cost.
Oh my!
So you can imagine how popular it is.
Oh my! How is this hospital able to do that?
Well, donors. But a lot of our patients and their families sit in this space because we do have the rocking chairs that look over the garden area. It's a good space to wait. This is for patients and their families. Students could actually come. We do have, as part of it, we have computers that are available. So there's some space to set up and get on the computer if they need to do any kind of research. This includes massage therapy. On Wednesdays we have acupuncture.
Ooh.
We have a demo kitchen that I can show you. There's some consult rooms there, and then we have an art room. So
neat. So art therapy.
But a lot of our physicians will send their patients here, say like orthopedics, they'll send their patients to have massage like the day before their surgery because it loosens their muscles and helps with the surgery.
Yeah, these are good prices.
And then on Wednesday, we have an acupuncturist who comes in and does her services here as well. We have art therapists who donates their time to do different classes and workshops.
That is neat.
So if somebody is, wanting to give back, they have a talent they want to share, we can make that available to either cancer survivors or just community at large. Presentations, stuff like that, demos, we do a lot of that. We do have audio visual space in the back where you could actually do a recording of a presentation. So you've got cameras mounted, that's the wide angle. And then you have the close-up of the kitchen, the stovetop. So if somebody's actually doing a cooking demonstration, they can, we can videotape it, edit it, and then we've got that library of content on that. So
Neat. Awesome.
Spartanburg Regional does have a YouTube page, and so we house all of our recorded webinars and videos there. When you have to meet with a physician or clinician, you don't want it so clinical. So we just, if this is intentional, that it's a little bit more comfortable for the patients and their families to come into this kind of space.
Right.
Instead of a patient room.
Yeah, it's definitely toastier in here.
It is. Yeah. So we do vestibular health. We do lymphedema. All that. So there's a lot of variety that goes on in here.
So the first thing you said was vestibular?
Vestibular, that's the vertigo dizziness.
Oh, okay.
And so that it's kind of addressing Meniere's disease, some of those issues that come up with the inner ear. So this is kind of the most popular view.
Wow.
You get
Angle.
a good angle view.
Wow.
Of the whole hospital and neighboring.
It just seems like every room is deliberately designed.
Yeah.
It's not cookie cutter.
No, for sure not. That is true. So not all of our rooms have a bed. These are for the ones who, would need a bed, need their services. Most of them have like a very nice, comfortable recliner. Then there's room for a caregiver, family member to come in and sit with them because sometimes their infusion can take up to 4 hours. So it's just kind of comfortable space. We do have volunteers who come and they would, get patient water or a blanket, stuff like that, whatever they need. So we do have, this is a very popular floor for our volunteers. So they're not here every day of the week, but certain days of the week.
So just regular doctor appointments?
Yes. If they're going to receive their treatment plan or, just an update or a 6-month checkup, whatever a lot of times they'll come and meet with their oncologist here.
Okay.
Thank you guys so much. This was the largest interview I've had. So we really appreciate your time and to educate our students on all the opportunities